First of all, I would like to start by explaining what is the definition of resting potential or resting membrane potential. Resting potential is the electrical charge difference across the membrane of a neuron when it is not actively sending a signal. It's the baseline state of the neuron setting it up to respond to incoming signal. This potential is key for preparing the cell to respond to any signal if it might receive. Now I would like to explain about the characteristic of resting potential. In resting membrane potential, the outside of the plasma membrane is positively charged compared to the inside. This is because both sodium Na plus channel and potassium K plus channel are closed. Thus, the sodium ion does not enter the cell. Meanwhile, the potassium ion does not leave the cell membrane. As you can see from the picture on the right, there is a high concentration of sodium outside of the cell and potassium inside of the cell. Potassium ion tends to leak out of the cell, making the inside even more negative. This combination of ions gradients and selective permeability creates the negative resting potential. And usually, the resting potential in most neurons is about negative 70 millivolts. The inside of the cell is negatively charged relative to the outside. Now, moving on to action potential. Action potential occurs due to the movement of ions into and out of the neuron. There are three stages in action potential, which are resting membrane potential, depolarization, and repolarization. Now, on to the first stage, which is resting membrane potential. As I explained earlier, in this stage, the outside of the membrane is more positive compared to the inside. This is because both of the sodium channel and potassium channel are closed, meaning the high concentration of sodium outside the cell membrane and the potassium inside the cell membrane, making the cell membrane negative inside and while in the outside more positive. As you can see from the graph, there's a red line. That is where the resting membrane potential is. Now, moving on to the second stage, which is depolarization. Depolarization occurs when the sodium channel open and potassium channel begin to open. Depolarization results because the inward movement of sodium ion makes the inside membrane more positive. If this change reaches a critical level called the threshold potential, which is around negative 55 millivolts, an action potential is triggered. As you can see from the diagram on the right, the sodium channel opens, making the sodium ions can enter inside the cell membrane, while the potassium begins to open, but the potassium ion does not yet leave the cell membrane. And on the graph, you can see the dotted line, which represent the threshold. The threshold in action potential is the critical level of membrane depolarization that a cell must reach for an actual potential to be triggered. And on the red line is where depolarization occurs. Now, moving on to the last stage, which is repolarization. Repolarization occurs when the sodium channel is closed and the potassium channel is fully open. This means the movement of sodium ions into the cell membrane stops. Meanwhile, the movement of potassium ion leaving the cell increases. The overflow of potassium ion making it the cell membrane to return to its resting state, which is repolarization. As you can see on the picture on the right, you can see that the sodium channel is closed and the potassium channel is open. Thus, the sodium ions cannot enter the cell membrane, but the potassium ion can leave the cell membrane. And on the far right, we can see the graph. Where the red line is, it is repolarization. But on the graph, if you notice, there's one point where it reaches negative 90 millivolts. That is hyperpolarization. Hyperpolarization occurs because the potassium channel are slow to close, causing an overshoot where the membrane potential is temporarily become more negative than the resting, which is around negative 90 millivolts. This slight hyperpolarization ensures the neuron briefly enters a refractory period, preventing immediate refiring. Then it restabilizes. The sodium potassium pump restores the resting balance of ion and potassium ion. Then it's ready for the next state. The membrane potential stabilizes back to negative 70 millivolt, which is the resting membrane potential. Now I would like to explain what are some common disorder, disease, and injury in nervous system. First of all, we will start with the Parkinson disease. I'm sure many of you have heard of this disease before. This disease is a degenerative disorder of the central nervous system. The symptoms are shaking, rigidity, slowness of movement, and difficulty of with walking. As the symptom worsen, completing a simple task will be difficult, such as talking, walking, and many more. Next is the Alzheimer's disease. This is a common form of dementia for older people. Its, its meaning is the loss of brain function. It begins slowly. It first involves part of the brain that controls thought, memory, and language, and it gets worse over time. Now, for the injury, we got traumatic brain injury, which is damage to the brain caused by external force, leading to a physical, cognitive, and emotional symptom. Someone who are involved in a combat sport such as UFC and boxing tends to get this injury more frequently. This is because they are always getting hit in the head. This is really dangerous because repetitive of this injury can cause a worse disease, such as the Parkinson disease. And a perfect example of this is Muhammad Ali, who is a professional boxer. During his career, he got many head injuries, which until the point that he got a Parkinson disease. Now, for the second injury, which is spinal cord injury. This is damage to the spinal cord that can result in loss of sensation of movement or function below the site injury. Usually, we see cases of accident where people get their back broken and they cannot walk. This is because of the spinal cord. The spinal cord is really important because it can help us control our movement. This is really dangerous if we involve in an accident which make our spinal cord injured. Now, I would like to talk about diagnosis, technology, and equipment. This is a way of how doctors can know what type of injury or disease we have. For the first equipment, which is magnetic resonance imaging, or many of you heard as MRI. MRI is ideal for visualizing soft tissue in the brain and spinal cord. It's really useful in the diagnosis of tumors, multiple sclerosis, strokes, traumatic brain injuries, and neurodegenerative disease such as Alzheimer. How this equipment works is the patient will lay on the bed and the bed will push forward until inside the machine. Meanwhile, doctors in another room can see the result of the scan and can determine what type of disease and injury we got. Now, for the second equipment, which is called electroencephalography, which record electrical activity in the brain by placing electrodes on the scalp, as you can see from the picture. This technique is widely used to diagnose epilepsy by identifying abnormal activator discharges. EEG can also aid in assessing brain function in coma patient, sleep disorder, and cause of suspected brain death. This tool equipment is really useful for doctor to know what type of injuries and disease we got.
Functions of endocrine system. Firstly, regulation of metabolism. Hormone like insulin and thyroid hormones help control the body metabolic rate, influencing how energy is produced and utilized. Secondly, growth and development. Hormones such as growth hormone and sex hormone play crucial roles in growth, development, and maturation. Thirdly, homeostasis. The endocrine system helps maintain the internal balance, regulating things like blood sugar levels, fluid balance, and electrolyte levels. Fourth, response to stress. Hormones like cortisol and adrenaline are involved in the body response to stress, preparing the body to react to challenges. Fifth, reproduction. The endocrine system regulates the reproductive process through hormones like estrogen and testosterone, affecting sexual function, fertility, and the menstrual cycle. Number six, mood and cognitive function. Hormones can influence mood, behavior, and cognitive functions, contributing to mental health. And last but not least, Immune function. Some hormones affect the immune system, helping the body respond to infections and maintain overall health. So, common disorder, disease, and injuries. So, first, diabetes mellitus. It has two types of diabetes, which is type 1 diabetes, an autoimmune condition where the pancreas produces little or no insulin, and type 2 diabetes, a metabolic disorder characterized by insulin resistance and relative insulin deficiency. Number two is hypothyroidism. It's a condition where the thyroid glands does not produce enough thyroid hormones, leading to symptoms like fatigue, weight gain, and depression. Third is Cushing syndrome, caused by a prolonged exposure to high level of cortisol, leading to symptoms like weight gain, high blood pressure, and change in skin appearance, like you all can see in the picture. So fourth is Addison disease, a disorder where the adrenal glands do not produce enough hormones, leading to fatigue, low blood pressure, and darkening of the skin. Like this guy, Tang, it has darkened. So the fifth one is adrenal injuries. Trauma to the adrenal glands can affect hormone production and lead to adrenal insufficiency. Related diagnosis technologies or equipment. Number one is blood test. Blood test has three kind of tests. First, hormone level test, measure level of various hormones, like such as insulin, cortisol, thyroid hormones to assess gland function. Second is glucose tolerance test. Evaluates how the body process glucose, commonly used for diagnosing diabetes. And last but not least, thyroid function test includes TSH, free T4, and free T3 to assess thyroid health. Second is urine test. It's a 24-hour urine collection. Measures hormone levels or metabolites over a full day, often used for adrenal function tests. Third is ultrasound, used to visualize thyroid nodules, goiters, and parathyroid glands. Fourth is CT scan, it's compute tomography, provides detailed image of the pituitary and adrenal glands, useful for detecting tumors or abnormalities. Fifth one is MRI, magnetic resonance imaging, particularly used for examining the pituitary gland and accessing any tumor or structural issues. So the function of blood. Blood cells are essential component of the circulatory system, playing crucial roles in maintaining health and homeostasis. They can be broadly categorized into three main types: red blood cells, white blood cells, and platelet. So red blood cells function oxygen transport. Red blood cells carry oxygen from the lungs to the tissues and return carbon dioxide from the tissues to the lung for exhalation. So for the characteristic of cells, the shape biconcave disc, which increase surface area for gas exchange and allow flexibility to navigate through capillaries. Lifespan approximately 120 days. They are removed by the spleen and liver when they become old or damaged. Hemoglobin content contains hemoglobin, a protein that binds oxygen and gives blood its red color. Enucleate mature red blood cells like a nucleus, allowing more space for hemoglobin. So, white blood cells function, immune response. White blood cells are a key player in the immune system, defending the body against infections and foreign invaders. So, characteristic types. There are several types of white blood cells, including neutrophils, respond quickly to infection. They are engulf pathogens. Lymphocytes includes B cells, produce antibodies, and T cells attack infected cells. Monocytes differentiate into macrophage and dendritic cells. They engulf and digest pathogens. Eosinophils combat parasites and are involved in allergic reactions. Basophils release histamine during allergic response and inflammation. Lifespan varies widely. Some live for hours, neutrophils such as neutrophils, whilst others can last for years. So platelets, the function is blood clotting. Platelets are crucial for hemostasis, helping to stop bleeding by clumping together in injury sites and forming clots. Characteristic the shape is small, disc-shaped cell and fragments derived from megakaryocytes in the bone marrow. Size much smaller than red and white blood cells. Lifespan typically around 7 to 10 days in circulation. Granules contains granules that release chemical such as serotonin. Clotting clotting factors to promote clotting and repair damaged blood vessels. The diagnosis technologies and equipment: ultrasound, sometimes used to visualize the spleen or lymph nodes, which can indicate issues with blood cell production or circulation, and blood culture tests, used to detect infections in the bloodstream by growing bacteria or fungi from blood samples.
Next, let's see the cardiovascular system. The cardiovascular system or circulatory system moves blood, oxygen, and nutrients throughout the body. It includes the heart, which pumps blood, blood vessel, arteries, veins, and capillaries, and blood. This system keeps cells nourished and removes waste. Blood flow throughout the heart. Step 1. Blood without oxygen from the body. Blood without oxygen enters the right atrium through the vena cava, superior vena cava, and inferior vena cava. Step 2. From the right atrium to the right ventricle. Blood flow from the right atrium to the right ventricle through the tricuspid valve. Step 3. To the lung for oxygenation. The right ventricle pumps blood through the pulmonary valve to the pulmonary artery to be sent to the lung, where the blood will absorb oxygen and remove carbon dioxide. Step 4. Oxygenated blood from the lung to the left atrium. Oxygenated blood returns to the heart through the pulmonary vein and enter the left atrium. Step 5. From the left atrium to left ventricle. Oxygenated blood flow from the left atrium to the left ventricle through the mitral valve. And last step, step 6, to the whole body. The left ventricle pumps oxygenated blood through the aortic valve to the aorta, where the blood is then sent to the rest of the body. Cardiovascular disorder. Definition: cardiovascular disorder are a group of diseases that affect the heart and blood vessel, including arteries and veins. Types of cardiovascular disorder. Coronary artery disease occur when the arteries that supply blood to the heart become narrow due to plaque. Hypertension. Persistent high blood pressure can damage the heart, blood vessel, and other organs. Heart failure. The heart is unable to pump enough blood to meet the needs of body. Heart rhythm disorder. An abnormal heart rhythm such as a beat that is too fast, too slow, or irregular. Valvular heart disease. A valve problem that disrupts normal blood flow in the heart. Let's see diagnosis technologies or equipment. First, electrocardiogram or EKG or ECG. Function: record the heart electrical activity to identify abnormal heart rhythm and blood flow problem to the heart. Usage: used in basic screening or to monitor heart into the long term. Echocardiography function use sound wave ultrasound to produce image of the heart, examining the structure and function of the heart, including valve and blood circulation. Usage to detect heart failure, heart valve disease, and structural defects. Heart pressure test function measure how to the heart respond to physical stress, usually by running on treadmills or using a stationary bike. Usage help diagnose coronary heart disease and determine the fitness level of the heart.
So respiratory system, I will talk about the mechanism of exhalation and inhalation. Inhalation. First is muscle contraction. The diaphragm, a dome-shaped muscle at the base of the thoracic cavity, contracts and moves downwards. The intercostal muscles, located between the ribs, also contract, causing the ribcage to expand outward and upward. Second is volume increase. As the diaphragm moves down and the rib cage expands, the volume of the thoracic cavity increases. And thirdly, the pressure changes. According to the Boyle's law, an increase in volume leads to a decrease in pressure within the thoracic cavity. And the pressure inside the lungs becomes lower than atmospheric pressure. So for exhalation, first is muscle relaxation. The diaphragm relaxes and moves upward, returning to its dome shape. The intercostal muscles also relax, causing the ribcage to fall back to its original position. Second, the volume is decreased. The relaxation of these muscles decrease the volume of the thoracic cavity. So thirdly, the pressure changes. As the volume decreases, the pressure in the thoracic cavity increases. The pressure inside the lungs became higher than atmospheric pressure. Exhalation. Fourth is airflow. Air is pushed out of the lungs and expelled through the trachea and bronchi, exiting the body. Common disorder and disease. First one is asthma, a chronic condition characterized by inflammation and narrowing of the airways, leading to difficulty breathing, wheezing, and coughing. Asthma can be triggered by allergens, exercise, and respiratory infections. Second is pneumonia, an infection that inflames the air sacs in one or both lungs, which can fill with fluids or pus. Symptoms often include cough, fever, chills, and difficulty breathing. Pneumonia can be caused by bacteria, viruses, or fungi. So third is tuberculosis, a contagious bacterial infection primarily affecting the lungs, though it can spread to other organs. Symptoms include a persistent cough, chest pain, weight loss, and night sweats. The fourth is sleep apnea, a sleep disorder characterized by repeated interruptions in breathing during sleep. Common symptoms include loud snoring, choking, or gasping during sleep, and daytime fatigue.
Now, moving on to digestive system. What is digestive system? Digestion is the process of complex substances into simpler one for easy absorption and assimilation by the body. Now, I would like to explain of how process digestive system works. Before I explain in detail, I would first like to list on how the process of digestive system. First of all, food enters through the mouth, then it goes to the esophagus, through the stomach, and then enter duodenum, and enter small intestine and large intestine. After that, it will go to the rectum and lastly goes out through the anus. Now, for the first process of digestive system, which is the mouth. Food is mechanically broken down by the teeth. Saliva containing the enzyme of amylase, which break down starch into glucose, break down chemically to help the food mushy and easy to swallow. The tongue pushes the food that we already munched now, which is called a bolus, to the esophagus. After we swallow, the bolus will travel down the esophagus through a process called peristalsis, which is the coordinated muscle contraction that propel food toward the stomach. Esophagus is just like a tube for the bolus to enter from the mouth to the stomach. Next is the stomach. The bolus enter the stomach through the lower esophagus sphincter. There are two types of digestion in the stomach, which are mechanical digestion and chemical digestion. In mechanical digestion, the stomach muscular wall churn the food, mixing it with gastric juice. Chemical digestion: gastric juice, which contain hydrochloric acid, and the enzyme pepsine begin breaking down proteins into smaller peptides. The stomach pH value is 2 to 3. Formation of chyme. The mixture of food and gastric juice is called chyme. The stomach holds the chyme for about 2 to 4 hours before it gradually releases it into the small intestine. Now, I would like to talk about the duodenum. Lots of enzymes found in this area are secreted from the pancreas, which are lipase, amylase, proteases, maltase, sucrase, lactase, and arabsine. For lipase, which is the breakdown of fats, amylase, the breakdown of carbohydrate, proteases, the breakdown of protein. Maltase is an enzyme found in the small intestine that plays a critical role in carbohydrate digestion. Its primary function is to break down maltose, a disaccharide sugar, into two glucose molecules. Then, moving on to sucrase. Sucrase is an enzyme found in the small intestine that aids in carbohydrate digestion by breaking down sucrose, which is table sugar, into glucose and fructose, two simpler sugars that the body can absorb. And for lactase, lactase is an enzyme found in the small intestine that help digest lactose, the sugar found in milk and in dairy products. Its primary function is to break down lactose into glucose and galactose, two simpler sugars that can be easily absorbed into the bloodstream. Now for eripsim. Eripsim is a mixture of proteolytic enzymes found primarily in the intestine, particularly in the small intestine. These enzymes play a crucial role in the final stages of protein digestion by breaking down small polypeptides into amino acid. Now, inside the duodenum, bile is also found. Bile is also secreted from the liver. The function of bile is to emulsify fats. Now, for the fifth process of digestive system, which is the small intestine. Inside the small intestine, the intestinal juice contains the same enzymes as the duodenum. Most food is digested here as it is 8 meters long. The wall of the intestine contains millions of finger-like projections called villi. What is villi? Villi, which is they play a vital role in nutrient absorption by increasing the surface area of the intestinal lining, allowing for more efficient absorption of nutrients into the bloodstream. Now, I would like to talk about the large intestine. The large intestine, or known as colon, is about 5 feet long and it also connects the small intestine to the rectum. Its primary function is to process weight and absorb water and electrolytes. For absorption of water, large intestine absorb water from the indigestible food matter. This process helps from solid waste or feces, preventing from dehydration. Now, for electrolyte absorption, the large intestine absorbs electrolytes such as sodium and potassium, which are essential for maintaining body fluid balance and nerve function. Now, I would like to talk about the rectum. The rectum is the final section of the large intestine that stores feces until they are ready to be expelled by the anus. Now, I would like to talk about the last part of the process of digestive system, which is the anus. The rectums open into the anus where feces are expelled from the body through the defecation. And this is it. This is the final process of digestive system. So to summarize the process of digestive system, it started from the mouth, goes to the esophagus, and to the duodenum, to the smaller intestine, large intestine, to the rectum, and lastly through the anus. That is all. In digestion, there are many types of digestion. One of the type is chemical digestion. Chemical digestion is the process by which food is broken down into smaller, absorbable molecules through the action of enzymes and other chemicals in the digestive system. Now, I would like to explain the chemical digestion along the gastrointestinal tract, starting off with the mouth. Salivary amylase break down starches into simpler sugars. Now, the stomach. The stomach, pepsin begins the digestion of proteins into peptides. Meanwhile, the hydrochloric acid helps denature proteins and kill pathogens. And lastly, the duodenum. Inside the duodenum, amylase continues starch digestion, and proteases further digest proteins into smaller peptides and amino acid. And lastly, lipase break down fat into fatty acid and glycerol. That is all. Now, I would like to talk about the diagnosis technologies and equipment that doctors use to help us identify the type of health problem we have regarding the digestive system. One of the technologies are endoscopy. I'm sure many of you heard of this equipment before. Endoscopy is a flexible tube with a camera that is inserted to the mouth to examine the esophagus, stomach, and upper part of the small intestine. This procedure is used to diagnose GERD, ulcers, gastritis, and also cancer. As you can see from the picture, a tube is entered through the person's mouth and to the stomach. Inside the tube, there's a camera which the doctor can see from the screen beside them. This can be really easy for the doctor to help diagnose the type of health problem we got is internal of our body. Now for the second equipment, which is ultrasound. I'm sure many of you thought ultrasound is used for pregnancy, but there are many other ways ultrasound can be used. Now, ultrasound is a non-invasive imaging of the liver, gallbladder, pancreas, and other abdominal organs to detect stones, tumors, inflammation, and liver condition like cirrhosis. Now, moving on to the next topic, which is urinary system. What is urinary system? Inside our blood, there's a waste called urine, and the function of urinary system is to remove that waste, and that is why we call urinary system. Now, I would like to explain the process of filtration in urine formation. The first process is glomerular filtration. Blood flows into the glomerulus through the afferent artery. The high pressure in these capillaries forces water, ions, glucose, amino acids, and other small molecules out of the blood and into the Bowman's capsule. As you can see from the picture on the right, on the top left is a blood vessel where blood enters through the afferent artery to the glomerulus. The glomerulus is where the dotted circular line is. After that, the, the high pressure in the capillaries force small molecules out of the blood into the Bowman capsule. Now, I would like to explain about the Bowman capsule. The filtration process is blood flows into the glomerulus. The blood pressure forces small molecules like water, salt, glucose, amino acid, and waste product out of the blood and into the Bowman's capsule. This is filter fluid is called the glomerular filtrate. The glomerular filtrate contains sweet substance like urea and valuable substances like glucose and electrolytes. However, large molecules like proteins and blood cells do not pass through the glomerular filter. The walls of the glomerulus and Bowman's capsule act as filtration barrier. The beginning of urine formation began once the fluid enters the Bowman capsule. It flows into the rest of the nephron, where various parts of the nephron will reabsorb useful substances and concentrate from the waste into urine. Now, moving on to the tubular reabsorption. After filtration, the filtrate moves into the renal tube, where essential substances are reabsorbed back into the blood. They are reabsorbed by the capillaries into the bloodstream. If blood levels of certain substances are high, the substances will not be reabsorbed. Few examples of the substances that are reabsorbed are water, which is 99% reabsorbed, sodium, 99.5 reabsorb, ura 50% reabsorb, and phenol, which is 0% reabsorb. Lastly is the tubular secretion. Tubular secretion is the process in which renal tube extracts chemicals from the capillary blood and secretes them into tubular fluid. This process serves two main purposes. The first one is waste removal. Uric acid, bile acids, ammonia, and creatine are secreted into renal tubule. Tubular secretion clears the blood of the pollutants and drug as well. Second is maintaining the acid-base balance. Tubular secretion of hydrogen and bicarbonate ions serve to regulate the pH of the body fluids. Now, I would like to talk about the diagnosis technologies and equipment which doctors use to diagnose patients with the health problem they got regarding the urine system. The first equipment which is fluoroscopy, which uses contrast dye to visualize the bladder. It detects stone, obstruction, abnormalities, or injuries in the urinary tract. And the second equipment is ultrasound. It's a thin tube with a camera, stethoscope. It's inserted to the urethra into the bladder. Usage is allow direct visual examination of the bladder and urethra used for diagnosis bladder cancer, infection, and blockages.
Next, let's see reproductive system. The reproductive system is responsible for allowing organism to produce offspring. In human, it has different structure for male and female. So for the first, let's see male reproductive system hormone. First, testosterone. Role: develop male characteristics like muscle and facial hair and stimulate sperm productive. Second, follicle stimulating hormones or FSH. Role: promote sperm production by acting on cells that support developing sperm. Next, luteinizing hormones or LH. Role: stimulates testosterone production in the test. Next, inhibiting role: regulates sperm production by controlling FSH level. Female reproductive system hormone. First, estrogen. Role: develop female characteristics like breast tissue, regulates the menstrual cycle and support bone health. Progesterone. Role: prepare the uterus from pregnancy and maintains it if pregnancy occurs. Follicle stimulating hormones or FSH. Role: stimulates EGG development in the ovaries. Luteinizing hormone LH. Role: triggers ovulation, release of an EGG. Human chorionic gonadotrophin or HCG. Role: maintains pregnancy by supporting hormone production after an EGG is fertilized. Next, oxytocin. Role: cause contraction during childbirth and aids in milk release during breastfeeding. The role of placenta during pregnancy. The placenta is a vital organ in pregnancy, acting as the interface between the mother and fetus. Its key role includes: first, nutrients and oxygen exchange. The placenta allows nutrients and oxygen from the mother blood to pass to the fetus. It also removes waste products such as carbon dioxide from the fetal blood. Number 2, hormone production. The placenta produces several important hormones including human chorionic gonadotrophin, progesterone, and estrogen. This hormone helps sustain the pregnancy, regulates fetal growth, and prepare the mother body for childbirth and lactation. Number 3, immune protection. It acts as a protective barrier, preventing mouse bacteria and other pathogens from reaching the fetus. Adult, some viruses and harmful substances can cross. Number 4. Waste elimination. The placenta helps in the removal of fetal waste, which is then processed by the mother organs. Number 5. Antibody transfer. During the later stage of the pregnancy, the placenta transfers antibodies from the mother to the fetus, providing the baby with some immunity against infection in early life. Let's see diagnosis technologies and equipment. Ultrasound imaging. 2D ultrasound commonly used to view placental position, structure and blood flow. 3D or 4D ultrasound provides detailed image helpful for identifying issues like placenta previa. Doppler ultrasound measure blood flow in the umbilical artery and placenta to check fetal oxygen and blood supply. Magnetic resonance imaging (MRI) used if ultrasound is unclear giving detail. Radiation-free image of the placenta and fetus, useful for diagnosing conditions like placenta acquired. Placental function test. Amniocentesis, mainly for genetic testing, can also assess placental health via amniotic fluid analysis. Chorionic villus sampling or CVS, yearly test of placental tissue to detect genetic and chromosomal issues. Biomedical blood test. Blood test measure placental marker, e.g. HCG, PAPP, AFP, to evaluate placental function and fetal health. Abnormal result may suggest conditions like preeclampsia or placental insufficiency. Non-invasive prenatal testing or NIPT. Analyze fetal DNA in the mother blood to screen for chromosomal abnormalities safely.